your student nurse today, so let me just check your first and last name and date of birth and any allergies with this wristband. And at this time, I would have already verified the other 7 patient rights. So I'm here today because your provider asked me to insert an NG tube into your stomach. That way you can still get nutrition while your mouth is wired shut. Okay, so I'm just going to check your nasal patency right now, so if you can just go ahead and blow out for me. Thank you. And blow. Alright, so at this time I would listen with my stethoscope before I palpate your abdomen. So I'm just going to go ahead and palpate for any tenderness. Any tenderness there, Amanda? No? Okay, so I'm going to go ahead and get started. So first thing I'm going to do is I am going to measure the NG tube to make sure that we're in the right place. So I'm going to go from the nose to the ear to the xiphoid process, and I'm going to mark it with a piece of tape, which I have already done. So first I'm just going to put a little bit of lubricant on it. That way it'll make it a little bit more comfortable for you. Okay. I'm going to put this here just in case you need it. So I'm just going to want you to tilt your head back for me, and I'm just going to go ahead and go. Alright, you're doing great, Amanda. And I'm going to tilt your head forward, and every time that I ask you to take a sip, if you could swallow for me, and I'm going to move the tube in a little bit farther. Okay, so swallow for me. Swallow. And then swallow. Alright, thank you, Amanda. You did great. So I'm going to go ahead and move this out of the way. And I'm just going to go ahead and take this right here. Alright, you're doing great, Amanda. Alright, is that comfortable for you? Okay. Let me put one more piece of tape on your nose. Alright, and I'm just going to go ahead and tape it to your shoulder, so if you could look away from me. Alright. Alright, just keep on looking away. Alright, there you are. So now I'm just going to check to make sure that it's in the right place with an air bolus of 30 mils. Okay. So I'm just going to push in 3 short bursts of air. Alright. It sounds good, Amanda. It sounds like we are in the stomach, but I am going to go ahead and call radiology to make sure with an x-ray. And I'm going to make you feel a little bit better with a little bit of oral care. Alright. You did great, Amanda. So I'm going to go ahead and call radiology after I step out, but if you're doing okay, I'm going to go ahead and leave you sitting up, but I am going to lower the bed for you. That way radiology will have an easier time doing the x-ray. Alright, if you don't need anything else, I'm going to go ahead and leave. Thanks, Amanda.